Assalamu alaikum. Our Prophet sallallahu alaihi wasallam said, if the son of Adam dies, his deeds are cut off, except for three: outgoing charity, beneficial knowledge, or a good child who prays for him. Did you know how many Muslims are living with diabetes today? Well, it's over 150 million Muslims out of 530 million people worldwide living with diabetes. Did you know how much Muslim countries spend on healthcare compared to non-Muslim countries? Unfortunately, Muslim countries spend less than 5 times than a non-Muslim country. At Smart Health, we believe that Muslim lives matters. Muslims must prioritize spending on prevention techniques rather than only on treatment. The care of diabetes can cost over $4,500 annually, but diabetes complications can cost up to $6,000.
I'm Ahmed Al-Malla, the founder of Smart Health. Today, I will let you know why Muslims need to be involved in our project. I'm here because I want to help my family and your family. I lost my father's life over late diagnosis, just because he couldn't see a skilled doctor at the correct time. My mother has been suffering from diabetes for the last 5 years. The day-to-day monitoring of her food intake, blood sugar, and insulin are hard to trace. So, this is what led me to initiate Smart Health Project. It is a service to save patients with diabetes and cardiovascular diseases by reducing the probability of developing chronic complications. Over the past 2 years, we spent over 13,000 working hours and over $40,000 developing healthcare solutions with one goal above everything: how to save people's lives. In Smart Health, we built an app to facilitate remote clinical team monitoring for patients. Our mobile app helps patient guardians to monitor the health of their beloved family around the clock.
I knew Ahmed for almost a year, and I was interested to Smart Health solution for my brother-in-law who got a heart problem due to prolonged and unmanaged diabetes. My family were looking for the device that can give a quick and reliable measurement of some of the key vital signs of the body, such as ECG, SpO2, and blood pressure, and be able to store the data on the app or sync it to a central patient record on the cloud. By that measurement, I expect the device allow the user to detect changes in heart function that require intervention by a doctor. So it can be an early warning system for the patient while saving the measurement history to be reviewed by a cardiologist.
Smart Health aims to save 5,000 lives in the next 5 years. We will start with a 24/7 clinical team monitoring, and this will help us build our artificial intelligence models. This will identify patients with high probability of developing chronic diseases complications. We have 3 prevention plans. So our first plan will be to prevent diabetes patients from getting cardiovascular diseases by monitoring their daily carbs, glucose levels, and insulin intake. An estimated 86% of the patients with type 2 diabetes mellitus get cardiovascular disease, which is the cause of death. Our second prevention plan will be to prevent cardiovascular diseases patients from getting heart attacks by monitoring their ECG measurement in real time. Our last prevention plan will rely on using artificial intelligence to predict prediabetes in our patient family members and help them control their weight and diet. Here is what the patient journey will look like. The patient will measure his vitals daily. For example, his glucose level or his ECG using an FDA-cleared all-in-one medical device. The device uses Bluetooth to transfer all the measurements to our mobile app. The app will store the vitals on the cloud for real-time monitoring by his guardians and by the 24/7 clinical team.
The clinical team will call our patient and his guardians when there is an abnormal health condition, and either book an appointment with a doctor or guide the patient with the necessary medical procedures after consulting the physician.
Patients will use our app to grant access to their medical records to physicians managing their cases that are stored in the Electronic Patient Record System, EMR.
The centralized EMR system will store all the patient medical diagnostics, lab results, and vital signs.
The artificial intelligence models will be able to give the clinical team warnings about near future complications for each patient. We are calling out for support to enhance our mobile app, build the web monitoring platform, and hire the 24/7 clinical team. I contributed to my limit for something that I believe can benefit Muslims. Now it is your turn to contribute and donate to this project.
Thank you for listening, watching, and for spreading the word. And most importantly, making dua for us.